of live broadcast. Welcome, my friends. In today's live stream, we are going to talk about cholesterol. I'm sure a lot of people here have this problem. Moacir, my test showed high cholesterol. I have my test results here to show you. What should you do? My total cholesterol came back high. The doctor prescribed me statins. And then I started taking statins. I began to feel body aches, started having memory problems, tiredness, fatigue, and impotence. So what to do? Well, we're going to talk about this issue of high cholesterol, how to properly evaluate your test results. First thing, how to properly evaluate your cholesterol test. Is cholesterol really that problematic? Yes or no? Should you be worried? Do you have to take medication to lower cholesterol or not? And alternatives? Are there any alternatives to lower cholesterol? Let's talk about all of that here. This wire is a bit there. Now it's good. Let's talk about all of that here. But first, my friends, I wanted to tell you about NutriAge supplements, okay? Check out the NutriAge supplements I take. Omega-3 Arthro DK2 Magnesium. NutriAge is the supplement brand aimed at people over 40. So if you, like me, are over 40, I'm already over 50, right? You should check out NutriAge. NutriAge's vitamin D is more concentrated. It comes in MCT oil. The magnesium has 3 types of magnesium. The creatine has taurine and HMB. The omega-3 has celomeg-3. So these are supplements designed for people over 40. 40 plus, 50 plus, 60 plus, 70 plus. So if that's your case, go to the NutriAge website, okay? It's www.nutriage.com. I'll put it in the chat. It's www.nutriage.com.br, okay? Don't forget to check it out. Hey, how are you? Well, that said, let's start our conversation about cholesterol. Very well. High cholesterol. I want to start our live by letting you know that my cholesterol is high, okay, my friends? I have high total cholesterol. I've always had it. It's always been high. As a result, my testosterone is also high. Why is that, Marcio? Is there any connection? But why is this camera? Oops. Is there any connection? High cholesterol and high testosterone are totally related because testosterone is produced from cholesterol. So if you lower your cholesterol levels too much, you can harm your hormone production, okay? Then, in the case of women, progesterone, estrogen, and even testosterone itself. Women also have testosterone. So you need cholesterol to produce these hormones. You need cholesterol to produce vitamin D. So, for example, people who take statins, medication to lower cholesterol, need to supplement vitamin D, okay? You have to supplement. Here, look, let me show it here for Instagram. So, my friends, cholesterol is important. First, I want to demystify this issue about cholesterol. Cholesterol is not all bad, okay? Cholesterol, as I just mentioned, hormones, testosterone, estrogen, progesterone, vitamin D. For the formation of bile to digest fats, you need cholesterol, right? Cell membranes need cholesterol. If cholesterol gets too low, memory and reasoning start to fail. Why is that? Because neurons, the cell membranes, need cholesterol. So several studies have already shown that very low cholesterol leads to an increase in mortality from all causes. People with low cholesterol die more from infections, die more from cancer, die more from diseases, considering all causes, okay? Because people often worry about cardiovascular disease. But what really matters is whether you live or die, right? If you die from a disease, you might not die from cardiovascular disease, but if you die from an infection, you're still dead. So what then? You died because you end up stopping cholesterol production. No, cholesterol is not a fat, okay? Many people think cholesterol is a fat, but it's actually an alcohol. Chemically speaking, in Daniel's question, chemically speaking, cholesterol is an alcohol, not a fat. But it has that reputation, okay? That reputation came from the studies by Dr. Ansel Keys, which were called the 7-country study. That study was completely biased, but that's a story for another Ultra Live, okay? One day I'll do a live stream just about the history, about why cholesterol got such a bad reputation. So let's go. Moacir, why is my cholesterol high? And why is it most doctors say you have to lower it even if it means using medication? Well, cholesterol is so important in our body, my friends, that it is produced in our liver. Cholesterol is essential. We can't be without it. So our liver is responsible for producing cholesterol. 80%, pay close attention to what I'm about to say, 80% of the cholesterol circulating in our body is produced by the liver, okay? 20% of cholesterol comes from our diet, right? That fatty steak, which I personally like a lot, right? That fatty meat. The cholesterol from food makes up 20% of the cholesterol circulating in our body. So we have homeostasis in our body. It works like this. If you consume little cholesterol from your diet, your liver will produce cholesterol because we can't run out. If you consume a lot of cholesterol from your diet, fatty steak, your liver stops producing cholesterol. So your cholesterol levels will be the same regardless of how much cholesterol you consume. Pay close attention, my friends, because what I'm about to say is very important, okay? Your cholesterol levels will remain the same regardless of how much cholesterol you consume. Because if you consume little, if you go on a diet, cut out animal fat, cut out butter, right? Everything that has cholesterol like butter and eggs, you'll consume less, but your liver will produce more. So your levels will stay the same. If you consume a lot, eat 3 or 4 eggs a day, eat fatty meat, animal fat, your liver will produce less. So consuming less cholesterol won't impact your cholesterol levels. No, cholesterol is not a fat, okay, my friends? I just explained it here, Daniel. And I just explained why eating less animal fat won't impact your cholesterol because your liver produces 80% of your cholesterol. This is a very important point because those who have high cholesterol problems need to follow the approach I'm going to explain here, what really raises the truly bad cholesterol. First, what is truly bad cholesterol? What do we call truly bad cholesterol? They are small, dense cholesterol particles that are potentially oxidizable. Because LDL, which is called bad cholesterol, isn't really that bad. In fact, there are 11 fractions of LDL, and only 2 of these fractions are small, dense, and potentially oxidizable. So I'll talk about tests in a bit, how you evaluate them. That's it. Not all LDL cholesterol is bad, okay? This is a very didactic way that's taught in colleges nowadays, but it's not necessarily true. I'll bring some studies here for you. So first, not all cholesterol is bad. Second, the increase in total cholesterol doesn't happen because of cholesterol intake, but because of the intake of another type of food. Do you know what really raises cholesterol and is actually bad? Fructose. What is fructose, Moacir? Processed food, my friends. You can check the label, it's there. Corn syrup, fructose syrup, glucose syrup, all of that is fructose. Soda sweetened with fructose. Does fruit juice have a lot of fructose? Yes, but that's not really the problem, okay? The problem is the sweetened processed drinks. The problem is processed foods, which all have fructose. Juice is something you'll have once a day. It won't make much of a difference. But if you only eat processed foods, you're getting fructose, and then you go and drink soda, that's even more fructose. Then you go and drink box juice, more fructose. Then you eat more processed food, more fructose. It all adds up, It's not just an isolated amount, it's the sum. And this sum of fructose, the fructose that you can check the metabolic map in cholesterol synthesis, fructose is involved. So, first point, fructose impacts your cholesterol levels more than the animal fat you're consuming. First point. Second point, inflammation raises your cholesterol levels. Why? It both raises and oxidizes cholesterol. Because as you inflame your body, this camera is acting up, you see? It's turning over here. As you inflame your body, cholesterol comes in to do the repair. And this repair, see, it's not, I almost have to hold it in my hand here. Stay quiet there, girl. So this cholesterol, it repairs the tissue, right? So the tissue is there, your body is inflamed, it causes a laceration in the tissue, then the cholesterol goes there to repair it. That's why cholesterol has the reputation of causing atheroma. Actually, it doesn't. In fact, it's the small and dense cholesterol, which are only two types. When you're inflamed, because then macrophages act on this cholesterol, triggering an inflammatory process. That's when atheromas form. That's when the formation of the atheroma happens. So this cholesterol that was raised by fructose, not by animal fat, this oxidized cholesterol causes inflammation and leads to the formation of atheroma and inflammatory substances, which few people talk about. But did you know that alcohol increases your cholesterol? That's right. If you have very high cholesterol, only the bad cholesterol, I'm going to teach you the calculations here. Alcohol is one of the main factors that impact this bad cholesterol. So, people who drink every day, who abuse alcohol, have high cholesterol. Not because they're eating animal fat, but because they're consuming alcohol. So there are two villains here that I've already mentioned. Alcohol and fructose. If you cut alcohol and fructose from your cutting is hard, but if you reduce your intake of alcohol and fructose, you'll have a big impact on your cholesterol. For example, I have high cholesterol. I'll give you my own example here. I have high cholesterol. I've always had it since I was a child. When I go on vacation, during that Christmas and New Year's period, then usually I go to the beach in January. And then what happens to all of us, my friends? We overindulge. Christmas is when the overindulgence starts. Actually, it starts before Christmas. It starts at the company get-together. That's when it starts. Overindulging in alcohol, it's a drink, it's the wine, then comes Christmas, then comes New Year's Eve, then I go to the beach too. I'm going to enjoy it. That's right. You really have to enjoy it. Then you go there, alcohol at the beach. That was my case. All right, cool. I got back from the beach. What happens then? I took a cholesterol test, which is already high. It went way up. So what do I do every year? I come back from my vacation and say this. Stop. I stop and I don't drink alcohol anymore. I go without alcohol until after Carnival. I go more than 2 months, right? I go 2 months without drinking alcohol. What happens to my cholesterol? Then I make a point of getting a test right after. I just did one here. Look, my cholesterol goes down. It drops because I quit drinking alcohol. Do you understand, my friends? And look, I don't even drink much, okay? I drink very little. Imagine those who really overdo it. Imagine those who really overdo it. So just to give you an idea of my experience, just by cutting out alcohol, which as I said, I drink very little, it already impacts my cholesterol levels. Imagine someone who drinks every day. Imagine someone who drinks on the weekend. Here in Minas Gerais, the weekend starts on Thursday, right? So my friends, okay, Daniel gave a good example. My father passed away at 89. He drank beer, liters, and all that. We can't take that as a rule, Daniel. This comes up in every life, okay? These people giving those examples. My grandmother lived until 93. My father lived until 89. Nowadays, 89 isn't that big of a deal, okay? Living to 89 isn't that impressive, okay? Today, it's easy to reach 100 years old. But your father, he didn't drink soda growing up like our generation does. He probably didn't eat ultra-processed food. He probably had a much more natural diet than we have today. So, okay, my grandmother smoked, I don't know how many years. That's an exception. Second, yes, she did that, but her life was much healthier. Her childhood and adolescence were healthier. So, guys, these exceptions don't really make much sense for us to bring into our discussion, but let's get back to cholesterol. So, my friends, look at how fructose and alcohol impact cholesterol. Now, I want to talk a little bit with you about tests, okay? Because I observe a lot. Test results show high cholesterol. You go to the doctor, and mine is right here. Look, I'll show you guys. I don't know if it'll show up on the live stream, but if it does, it'll be interesting, okay? To prove to you that my cholesterol really is high, LDL, HDL. Here it is, total. I found it. I'll show you here. Look. Can you see it? Look, my cholesterol is 247. Ideal for adults over 20 years old is below 190. Well, so 247. Do you take statins? No. Any doctor will turn to you and say, you have to take statins because your total cholesterol is 247. It's high. It really is high. But there's a correct way to evaluate it. Total cholesterol includes total cholesterol, HDL, LDL, VLDL, and the 11 types of LDL. You can't tell which is small and has this oxidizable property. What do you need to look for in the test? And I've seen people with cholesterol of 150 who are much worse off than I am. I'll explain why. The first thing you need to look at, the triglyceride ratio. Triglycerides to HDL. You're going to check what your triglycerides are. And mine came out here, look. My triglycerides look 88, very low. Why? Because I don't eat junk food. You're going to divide your triglycerides by your HDL. My HDL is right here. Look, 52. My number, I already did the math here. Look, it came out to 1.69. 1.69. The ideal is below 0.9. If you divide your triglycerides by your HDL, it needs to be below 1.9. If it's below 1.9, it's okay. Total cholesterol doesn't matter. Then there's another calculation that I'll show you here. This is the first calculation you need to do. Divide the triglycerides by the HDL. What does this measure, Moacir? It measures insulin resistance. Because a patient with insulin resistance oxidizes more cholesterol. The issue isn't the oxidized cholesterol. It's the oxidized cholesterol, not cholesterol itself. When you get this number, if it's higher than 0.9, it means you're insulin resistant. It means you have a higher chance of oxidizing cholesterol. That's the second calculation you need to do. Your doctor needs to order a test known as APOA and APOB, okay? You will take the ApoB and divide it by the APOA. This number needs to be below, some people say 0.9, some people say 0.8, but it needs to be in that range, okay? What does this APOA, APOB mean, Moacir? I won't go into details since there are healthcare professionals here and it could get confusing. I'll explain it simply and clearly instead. To put it simply, when you divide APOB by APOA, it means you have few fractions of small, dense, and potentially oxidizable LDL. Did you get that? These are the two calculations you need. You don't have to see a doctor just to check total cholesterol. You see the test, mine was 247. Okay, I'll take statins. That's not medicine. Medicine, not medicine. You evaluate the patient, you divide triglycerides by HDL, see if he has insulin resistance, take the opportunity to measure the patient's insulin. My insulin here was 6. It was 6, I already think that's high. I like it when it's around 435, but it was 6. There are people with insulin at 15 and the doctor says it's great. No, this is great. This live will be recorded on YouTube, okay, guys? Because if I have to repeat it here, then it gets complicated. Do you understand, my friends? So you have to evaluate the test. You have to evaluate the patient in a complete, holistic way. Practice real medicine. It's not just looking at total cholesterol and prescribing statins. I've seen people with low total cholesterol and a terrible ApoA to ApoB ratio, and with a terrible triglycerides to HDL ratio. Worse than someone with high cholesterol. And another detail that needs to be evaluated, okay? If your doctor doesn't ask for this, talk to him to, first thing, you should ask your doctor to check the ApoA to ApoB ratio, right? Because many don't ask for it. And you will measure inflammatory markers. This is very important. Because what happens, many times the patient, I'm going to bring an amazing study here for you. Many times the patient has high cholesterol. Okay? The ApoA to ApoB ratio is good. The triglycerides to HDL ratio is good. This patient doesn't need statins, okay? Statins cause a number of problems, all right? Statins cause a number of problems. There are people who need it, okay? Men who have already had a cardiovascular event, right? For example, my father needs to take it. He has 6 stents in his heart. He's a candidate. He needs to take it. Not because statins lower cholesterol. They actually have anti-inflammatory effects. But that's a topic for another time. So, my friends, another thing that needs to be evaluated in the patient, inflammatory markers. Why? If this patient has high cholesterol, but he has a good ApoA to ApoB ratio, a good triglycerides to HDL ratio, and low inflammatory markers, this patient is healthy. This patient does not oxidize cholesterol. This patient does not need statins. So take a thin patient, for example, me, thin, right? Thin patient, I've never had a cardiovascular event. I exercise every day, right? At least I try, right? I skip a day here and there. I have a healthy diet. I don't eat processed foods. I don't abuse alcohol or sugar. I don't even like them. I have my test results here. Look, my inflammatory markers are all low. My uric acid is low. My high sensitivity CRP, my fibrinogen is okay. AST, ALT, the liver markers are great. All my markers are good. Why on earth do I have to take statins? It doesn't make any sense. Do you see? Do you see how it's much more holistic, much more complicated? Isn't that true? You have to do these calculations. You have to assess the inflammatory markers. I'm going to talk about coenzyme Q10, okay? I'm going to talk about coenzyme Q10. But do you see that you need to evaluate the patient as a whole? And then you might ask me, Moacir, where did you get that from? Most doctors say that if your cholesterol is high, you have to take statins. Well, my friends, there's a study, but I can't show you the study here. I'll leave it on my broadcast list, okay? I'll share this article on my broadcast list, so it's important to follow me there. What did the study do? Because most cholesterol studies evaluate sick patients, patients who are already in bad shape. So they take a patient, in most studies, oh, this patient here has high cholesterol, that's why he had more heart attacks, right? Had a cardiovascular event, okay? But this patient also has high insulin, high inflammatory markers. All the markers are bad. So did this guy have a heart attack because he had high cholesterol, or because he was insulin resistant, because he had metabolic syndrome, or because he was all inflamed? Probably because he was all inflamed. But studies can't evaluate that. They can't isolate this important marker, which is cholesterol. So what did this study do? Look how interesting. This study is amazing, my friends, and it's still ongoing, okay? It took men of about the same age from the same ethnic group and separated them into 2 groups. The first group was healthy, everything was fine, cholesterol was measured. And the other group went on a ketogenic diet. What does the ketogenic diet do? It raises your cholesterol, okay? It's a healthy diet. It's a diet that I sometimes follow. For example, I'm on a ketogenic diet right now. It's great. It boosts brain function and reduces inflammation, but increases cholesterol. Your cholesterol rises. One reason mine is high is my more ketogenic diet. But these patients are healthy. So what did they evaluate? These patients who follow the ketogenic diet and have high cholesterol, and these patients who don't follow the ketogenic diet but have low cholesterol, they decided to measure the arteries, how much the arteries of these groups became clogged. What did they find out? The healthy group with high cholesterol did not develop plaque, and the healthy group with low cholesterol also did not develop plaque. So what did the study mean? Cholesterol levels do not impact plaque formation. What actually impacts it, as we already suspected, is inflammation. It's inflammation. So having low fibrinogen, low CRP, and low ferritin is much more important. Low homocysteine is much more important for your cardiovascular health than worrying about cholesterol. And what does everyone worry about? Cholesterol. You get your test results, and the first question is, how's your cholesterol? Have you ever noticed that nobody asks, how's your homocysteine? Nobody asks if the guy's homocysteine is at 18. Cardiovascular risk is way up there. Nobody asks. Nobody asks, how's your insulin doing? Far more important than cholesterol. How's your ferritin doing? Liver damage. Nobody asks. Everyone always asks about cholesterol. I had tests done yesterday. So what's your cholesterol? That's the least important thing. That's my first point, friends. That's what I wanted to share in this live. Second point, what do you mean? I trust my doctor and I really need to, okay? He says I have to take statins. I have a brother-in-law like that. The doctor says he wouldn't need to take statins, but he trusts his doctor. The doctor said he has to take statins. Okay, fine. He takes them. Life goes on. He feels safer that way, and that's all right, folks. There's no problem, really. But I told him, look, you're going to take statins, all right? But you need to, if you take statins, pay attention. This is very important. If you take statins, what do statins do, my friends? Statins are medications that inhibit an enzyme known as HMG-CoA reductase. This enzyme is there in the mevalonate pathway. It's called the mevalonate pathway. The mevalonate pathway produces cholesterol, but it also produces coenzyme Q10. And then you have two problems. When you inhibit HMG-CoA reductase, you stop producing cholesterol. You reduce cholesterol production. Problem number one, your testosterone levels will drop. Your vitamin D levels will drop, okay? Because both vitamin D and testosterone, estrogen and progesterone need cholesterol to be produced. So that's the first problem, okay? So evaluate, if you're taking statins, you need to check these markers. How is your vitamin D? How is your testosterone? How is your estrogen? How is your progesterone? First point. Second point, the mevalonate pathway, which produces cholesterol, also produces coenzyme Q10. Coenzyme Q10 levels will drop. So anyone who takes statins needs to take coenzyme Q10. You have to take it. Statins should come with it, my friends. A statin pill together with a little capsule of coenzyme Q10. And coenzyme Q10 is responsible for cellular respiration. It's an electron shuttle in the mitochondria. So when coenzyme Q10 levels drop, look at the symptoms that show up. People who take statins probably feel tired, fatigued, and have body aches. That's very common for those who take statins. Poor memory, slow thinking. Why? Because coenzyme levels are low, and coenzyme already starts to drop after age 40, right? So if you're 40 years old, you already need to take coenzyme. If you take statins, then you really need to take it and increase the dose. So you need to take coenzyme, preferably together with taurine, okay? It enhances the effect. And you need to take vitamin D. You need to take it, because vitamin D, again, I always emphasize this point, it needs to be between 60 and 80 nanograms per deciliter. It needs to be between 60 and 80 nanograms per deciliter. And if you blocked HMG-CoA reductase with statin, the production of vitamin D drops. Do you see, my friends, that it's not that simple? First of all, it's not just about looking at high cholesterol and starting to take statins. You have to do all this calculation we've been talking about. Divide the triglycerides by the HDL. Divide the APOB by the APOA. Evaluate the inflammatory markers. Then the doctor decided, no, this really is a case for statins because the patient has already had an event, already had to undergo angioplasty. If a patient has angioplasty, that's already an indication to start statin therapy, right? Not for cholesterol, but for its anti-inflammatory effects. So it's interesting and all right, give statins, but give coenzyme Q10 to this patient, give vitamin D, because their levels will drop. Certo, meus amigos? Natural alternatives for cholesterol reduction. You have red yeast rice, which is a type of rice. Red yeast rice is an HMG-CoA inhibitor. It doesn't have the side effects that statins have. Então, arroz vermelho é interessante. O hexanicotinato de inositol. It's also a substance that helps reduce cholesterol, especially the bad cholesterol. Não é? Exercício físico, meus amigos. Exercício físico, ele aumenta o HDL. Eu tô vendo o José Horácio falando aqui, HDL 32. Tem que subir esse HDL, tá? 32 tá... Improve. How do you raise HDL? Physical exercise. Physical exercise increases HDL, decreases resistance to insulin. In other words, it impacts triglycerides. Remember the triglycerides to HDL ratio? It will lower triglycerides and raise HDL. Então aquele número vai para baixo, que é o que nós queremos, né? Abaixo de 1,9. Certo? Então, red yeast rice, extra nicotinado, tem uma supplement, my friends, a base de bergamota. It's called, the name just slipped my mind, but it's made from bergamot. It's called, I forgot, I'll remember. The live stream continues here, I'll remember. It's on my list of supplements. But on my list of supplements, you'll find it there, okay? There's a supplement there called cholesterol redux, which is exactly this combination of hexanicotinate with red yeast rice. E tem esse outro que agora I forgot the name here. Sometimes I really have these blank moments, okay, guys? I think it's the excess work on the weekend. Saturday, I'll go live with you. It's not that I don't like it, I love it. Mas é a base de bergamota, tá? É extrato de bergamota. So there's a bergamot in the region of Italy that has a substance that mainly reduces this small, dense, and potentially oxidizable cholesterol. E, claro, ficar sem ingerir frutose, se você decrease fructose intake, berberine. I almost forgot about berberine, Regina. Thank you. That's right, berberine, my friends. Berberine not only reduces, it improves the cholesterol pattern, but it also reduces insulin resistance and increases insulin sensitivity. A diabetic patient really should be taking berberine, okay? Berberine has an extraordinary effect. Stop consuming fructose, take it easy. Isso tudo vai impactar o exercício. Physical exercise, all of that will impact the patient's improvement. We don't want to lower cholesterol. We want to improve the pattern. We want to improve the quality of this cholesterol. We want to improve that ApoB to ApoA ratio. We have to get that number below 0.9. In other words, you can even, look, my video just ended here on Instagram. Go figure, right? Good thing it'll be saved here on YouTube, right? So, my friends, it's because the internet went down. Whoa. Let's keep going here. So, my friends, basically, hypothyroidism, you can take berberine. These supplements, my friends, there's no restriction, okay? You can take any of them without any problems. Maybe in two situations, you have to be a bit careful. Not because you can't, but often because the doctor doesn't like it. It's the chronic kidney patient who's undergoing hemodialysis, already undergoing hemodialysis. It's important for you to inform your doctor about what you're doing, exactly so it doesn't impact your treatment. And to avoid having a problem and blaming it on the supplement. I see that a lot, right? They consume lots of sugar and alcohol, then blame magnesium as if that's truly the cause. And patients receiving cancer treatment, right? Let your doctor know, I want to start taking a vitamin C supplement. The doctor won't be against it. I want to take vitamin C, magnesium, and vitamin D supplements. The doctor will likely approve. Yes, you can, as it doesn't affect therapy. Just make sure to inform your doctor. So there are these points, my friends. First, a summary of our live stream. First, evaluate the tests correctly. Second, right? Evaluate cholesterol correctly, inflammatory markers. Second, what is really impacting this cholesterol? Is it excess fructose? Is it excess alcohol? Lack of physical exercise? And supplementation, if you take statins, coenzyme Q10, you need to take vitamin D. You always need to take D together with K2, okay? You need to take magnesium too. That's interesting. And supplements that help to modulate this cholesterol. Hexanicotinate, cholesterol. Cholesterol redux, which is on my list. Berberine also helps. Do you know what else helps a lot? And I take it every other day. Hibiscus tea. Hibiscus tea, really. I make hibiscus tea. Then I make that hibiscus concentrate. Then I mix it with sparkling water and drink it. First of all, I think it's delicious, right? Tasty. I think it's tasty. And second, it also helps with cholesterol modulation. That's right. And this bergamot extract, I forgot the name right now, but it's on my list of supplements, okay? So these will help to modulate, again, cholesterol. It's not such a villain after all. Cholesterol is necessary. You need cholesterol for hormone production, for vitamin D production, for brain maintenance, for cell membrane maintenance, and for bile production. So it has its importance. It's not such a villain, but you need to be careful, evaluate it properly, and do the modulation. Okay, my friends? My friends, I hope you enjoyed it. Don't miss it. And in a little while, we will start our podcast with special guests. So if you're not subscribed to the channel yet, subscribe so you can be notified as soon as it starts, okay? We should start our first interviews at the beginning of May. So stay tuned. It will definitely be, with your help, the biggest health podcast from Brazil. We will bring extraordinary guests for different topics, and we will discuss these topics there, which is what interests us, right? Living longer in good health. It's no use just living longer in good health, without medication, without needing to go to the doctor all the time, having interventions all the time. It's about living until 100, 120 years old, right? In good health, okay, my friends, I hope you enjoyed it. A big hug to you all. Share it, okay? Like it. Don't forget to like it, everyone. It doesn't cost anything. Go ahead, give it a like, leave a comment, right? Share it in that group. If you think this information is important and deserves to be shared, it doesn't cost anything to share. It doesn't cost anything to give it a like, okay? Thanks a lot, my friends. I'll see you in our next chat. See you then.